We shall now go through the markings for the three main areas. The first area we shall start off with is the glabella complex, which mainly encompasses the procerus and the corrugator muscles. If I could please ask you to frown. When the patient frowns, the bulge in the middle is the procerus. A good way of marking it is take the procerus in your hand gently and marking the center of it. It's then a good idea to take a hold of the corrugator muscles. The first injection point is placed at the medial brow, a centimeter above it. Once you have the corrugator in your hands, it's easy to feel the outline of the muscle, and the next injection point is a centimeter laterally and slightly above the original marking on that side. Then repeat the process on the opposite side. Like so. And that demonstrates the marking of the glabella. We shall now discuss the frontalis, or the forehead muscles. Our patient here is a prime example of a patient who has static as well as dynamic lines. The static lines are visible here and here. And if I could please ask you to lift your brow, and there are now more visible dynamic lines. Whilst injecting the forehead, it's very important to be aware of the zones or the danger areas which you need to try and avoid. The first thing to do is to mark the mid-pupillary line. On each side. It's very important to try and keep all the injections within this area, and it's also important to ensure that you're injecting at least a finger's breadth or a centimeter above the brow or the orbital rim. This is to ensure that the patient does not get a ptosis which could look something like that. Looking at this patient, you're able to see that she does have some static lines which extend laterally to the mid-orbital line. It is important to discuss this with the patient prior to the injections and let the patient know that these are not safe areas to inject, as it could potentially cause brow ptosis. Hopefully by the injection of the rest of the frontalis they may get some softening to those areas, but please do not be tempted to chase those lines, as you could end up with brow ptosis. The next muscle group we shall address is the frontalis muscle. As said, we need to keep within our zones of safety and ensure you're at least a centimeter above the orbital rim. There are many different variations to these injections. Some practitioners like to inject in a straight line. Some people put in a couple of rows of injections. A nice technique to use in females is using a slight V. One there, one there, one in the center. Like so. This patient has already told us that she does not want any elevation of her lateral brow, and to prevent this from happening, we shall then put a small amount of Botox, that is only 1 unit of Botox, 3 centimeters above the lateral brow. I shall do the same on the other side. Third area we shall now mark up are the crow's feet, or the orbicularis oculi muscles. If I could ask you to please smile. These are the lines that we're trying to soften. Whilst marking these, it is essential to stay at least 1 centimetre away from the edge of the eye, in line with the orbital rim. It's important to have this 1 centimetre zone of safety. Then put the first marking in the centre, the second slightly above it and curved inwards, and the third slightly curved inwards below the centre point. We'll then do the same on the other side, making sure to stay 1 centimetre away from the edge of the eye. The patient is now marked for all 3 areas, and we can now begin the injections. Before commencing the botulinum toxin injection, it's very important to take a photograph of the patient, which shall be kept in her records. These photographs should be standardized, so try and ensure the light settings are the same and that you are taking the photographs from the same distance every time. We shall now start off with the injection of the glabella complex. If I could ask you to frown again. Take hold of the procerus, as so. It's very important to keep the gradings of the syringe facing the practitioner so that you know exactly how much you are injecting into each area. Little scratch. Then move on to the next areas. It's important to keep your thumb at the base of the rim as such to prevent any diffusion of the toxin. And that completes the injection of the glabella complex. We shall now go on to the injection of the frontalis. These injections can be made at 90 degrees to the skin. Again, it's very important to keep the gradations facing you. Good idea to try and stretch the skin as much as possible to allow easy access of the needle. Then put a small area laterally to prevent the Spock look or elevation of the lateral brow. I'll repeat the same on the other side. And that concludes the injection of the frontalis muscle group. We shall now inject the orbicularis oculi muscle, or the crow's feet. Whilst doing these injections, it is vital to ensure that your needle is placed at an angle going away from the eye. There are often very small blood vessels around this area, and it is important, if you do see any, to try and avoid them, as this will obviously cause bruising. The technique involves stretching the skin. These injections are almost subcutaneous, and you should be able to see a very small bleb after each injection. We shall now inject the other eye. Again, it is essential to ensure the needle is pointing away from the patient. So once again, stretch the skin and look out for any superficial blood vessels. And that concludes the injections for the crow's feet.